we've got tons and tons of pre-made content, pre-made posters already there. So that's sort of an overview of some of the novel tactics that we're seeing being used to do voter registration. I want to say a couple words about scripts and conversation prompts. So we're going to, in a second, put in a URL that you can use to basically figure out which of the many different conversational prompts and conversational scripts work best for you in your practice. So here's how I tend to bring up the conversation when I'm with patients. So there are two different ways. One is when I'm reacting to the patient, commenting on my badge, or the second is when I'm proactively bringing it up with the patient. So often what will happen, like what happened a couple nights ago on an overnight, the patient asked me, "Hey doc, why does your badge say vote on it?" And I'll say, well, the reason why it says vote is if you want to, and if you're able to, you should, check to see if you're registered to vote. I think there's a lot of folks here who, COVID-19 has just made things much more difficult. And one of the things that people forget is voter registration. So if you're interested, I can help you get registered to vote or check your voter registration. Just send this text message to this number. So that's one example of sort of the reactive approach. The proactive approach comes in two forms. The first is when I'm taking my social history, I'll ask, do you smoke? Do you drink? Do you do illicit substances? Do you have sex with men, women, or both? Are you registered to vote in the next coming election? And sort of slip it into the sort of normal cadence of my social history. And then lastly, there are patients who are uniquely, I would say, in danger of actually voting in person. Remember, COVID-19 has made voting a public health issue. And sometimes I will bring it up with patients and say, look, just looking at your past medical history, a couple nights ago, I saw a patient who actually was post-transplant and was on Imuran and cyclosporin. And I said, there's really no way that I can suggest to you to go and vote in person. I think that would be a bad idea. So if you're interested, I can help you get your mail-in ballot. And I tell you that the look of surprise that the patient had that I could help them get registered to vote or help them get their mail-in ballot was pretty affirming. Feels like a new superpower to do in the hospital. So those are just some tips in terms of how to bring the conversation up and also how to respond to patients if and when they ask.